Protests at the Capitol as conservative leaders say no to expanding Medicaid in Texas.
The states can come up with the best solutions for their populations to run it, and the federal government's going to have to decide whether or not they trust us.
With the right money, can the state do better on its own when it comes to helping millions of low-income Texans?
Republicans on Medicaid expansion have gone from hell no to just no. I want to start hearing maybe.
Medicaid funding is on the line as the budget bill hits the House floor and the clock ticks closer to the close of the session.
Now, in-depth coverage of the Texas legislative session. In session, in depth.
Protesters say it's just what the doctor ordered, but Governor Perry's office says expanding Medicaid would be bad medicine for Texas. Good morning, I'm Josh Hinkle. Thank you for joining us. So far, the state has said no to a move that some say could give 1.5 million more low-income people health insurance. Right now, Medicaid covers about 3.3 million Texans. Over the week, that debate boiled over at the Capitol.
Seems to me an appropriate April Fool's Day. It makes it perfect to discuss something as foolish as Medicaid expansion.
A meeting of conservative minds.
What do we want? Healthcare! What do we want it now?
Nearly drowned out by the dozens of protesters who want Medicaid expanded to 1.5 million more Texans. Governor Perry argues spending money on what he calls a broken system would only bankrupt the state. Money that could go to roads, police, education.
It's not the solution.
Republicans instead want a block grant and flexibility to deal with Medicaid as Texas chooses.
The federal government is much like an unscrupulous individual trying to convince a junior high kid to start smoking.
The one way that won't work is the blockheaded approach of block granting all federal Medicaid funds to Texas.
Down the hall, Democrats shot back, urging a way to work with Washington on a solution that fits the state, but makes sure the money goes where it should.
This state doesn't have the best track record with this leadership in just taking money and simply using it to do what it wants.
Expanding Medicaid is not a solution. It's not even a Band-Aid for what ails us.
Looking in depth at Medicaid costs in Texas right now, the governor says Medicaid makes up about 1/4 of the state's budget. And if Texas took the expansion, it would make up about 1/3. It would cost the state an additional $15.6 billion over 10 years. The federal government would cover nearly $90 billion of the extra cost. No doubt it was on the minds of many House members at the end of the week as they tackled the budget bill. At a glance, the bill fully funds projected caseload for Medicaid before any expansion. It adds $265 million for mental health funding and $100 million for women's health services. But the fight for health money is far from over. With just under 2 months left in the session, a lot is still up in the air. Coming up, our Medicaid debate has two of the most outspoken political minds in Austin with two very different takes on expansion. Peggy Venable from Americans for Prosperity and Ann Dunkelberg from the Center for Public Policy Priorities. Next, when In Session In Depth returns.